Hello everyone, I am Dipak Aditya. In my earlier video, Organizational Change in General Practice, I proposed 12 changes. The first one was improving chronic disease management, CDM. The burden of chronic disease weighs heavy in Australia. Over $38 billion per year is spent on care for people with chronic health conditions. In this video, I focused on chronic disease management improvement in general practice. I would like to present this to you. Sections in the video. There are 5 sections, starting with the understanding of chronic disease and chronic disease management. The steps of CDM implementation, immediate, mid, and long term. There is a case study from Alberta and CDM practices in Australia. Included chronic disease model and change actions in relation to the model. Finally, there is a flow chart of change project for improving CDM. What are chronic diseases? The Australian Institute of Health and Welfare defines chronic disease which is persistent and long-lasting. Examples of chronic diseases are asthma, cancer, heart disease, diabetes, kidney disease, and mental health. Chronic disease management, CDM. GPs are involved in the CDM with GP management plan, GPMP, and team care arrangement, TCA. The team care arrangement requires multidisciplinary team including more than one provider for healthcare. Steps of implementing CDM. Immediate. Immediate steps include raising public awareness, education and training, service network, and ensuring all tools are available. Make sure the health services are promoting the CDM. Medium-term steps of implementing CDM. Implementation of a national policy framework is the first one. Use health system performance indicators and quality assurance tools to measure and report the quality of care. Consider evidence-based information service delivery for assertive case management. Use financial incentives. Long-term steps of implementing CDM. Make employers a key partner in the chronic disease management. Allocate resources within the health system. Focus on professional training on disease prevention. Empower community. Please see the case study in Alberta on chronic disease management. There was a team-based approach to care, aimed to integrate care between clinics, hospitals, and the community. Had centralized patient network, proactive care planning as well. Interesting to find the electronic health record system. I would like to propose that we should look into the recording system to include in the change in Australia. Here is the electronic medical record system EMR of Alberta. There is a provider portal. Alberta collects patients' information in every visit. EMR is partially connected to the data bank. Pathological laboratory results, diagnostic imaging information, prescription information, patient demographics, and facility location are all stored. There are data from many decades in green boxes. Chronic disease management in the general practices of Australia. There are two forms, GPMP and TCA. They are mentioned previously. Here I try to simplify the process with a flowchart. Regular review of GPMP and TCA is highly important in the planning cycle. The patient and GP should regularly check if the goals are being met. Practitioners plays a significant role in the assessment in addition to GP. Here is a case study of GPMP and TCA. The management plan includes Medicare items. A practitioner prepares a GP management plan and completes a team care arrangement after consulting with dietitians, nutrition specialists, speech therapists, and gastro specialists. Chronic disease management plans are usually multiple pages, including the list of medications. National Chronic Disease Strategy of Australia. The objectives of the strategy are preventing or delaying the onset of chronic diseases, reduce progression, maximize well-being, reduce hospital admission, and implement best practices in the prevention, detection, and management of chronic diseases. Direction of National Chronic Disease Strategy. It is ensuring primary health care, particularly in general practice. Identify and address the risk of chronic diseases, support self-management, and promote the use of patient registers and recall systems for better management, improve public awareness. The generic model of CDM, developed in 1996, is still very popular in the change initiative. The elements of the model are organization and healthcare, getting support from the management, decision support, delivery system design involving care delivery services, self-management support, community and resources that are linked to the change in CDM. Model is used in the following sections to develop change. Healthcare organization change actions. Ensure effective team. Consult with the practitioner, practice manager, practice nurse, all GPs in the practice at the reception. Improve general practice information system. Best practice and medical director software are widely used in Australia. RCGP advised using software for clinical information systems, electronic health records, secure message delivery, e-referrals, e-prescriptions, mobile health, computer-assisted history taking and disease registries. Improve your capability in the information system. Develop decision support. Organize problem-based learning sessions for the patients as well as provider. Adhere to the guideline. Organize interactive workshop to provide information on disease management. Enhance delivery system design. This is about implementing care innovation, delivering and exploring new methods of health education in primary care. Hold Diabetes Day and make certified diabetes educators available in the practice. Act as the facilitator of change and decision making in another delivery system design. Self-management. This is a very important one as well. Establish mutual goals and action planning. Focus on the teaching in group. Help develop skills in self-management and adjust lifestyle. Organize patient education and provide psychological support. Collaborate in decision making. Track self-management behavior. A community network is vital for CDM in general practices. Collaborate with the local hospital systems and specialists. Know them very well. Keep a list. Organize cultural workshops. Establish a patient-centered chronic disease management program. Never ignore patient complaints. Do not give chance to go to AFRA. Always resolve quickly. In the next slide, I attempted to present a flowchart of a change project in the general practice. Please see the flowchart. There is a repetition of change actions to simplify. I started with the consultations with the practice to establish a positive role for all changes. Then initiated clinical information system improvement. It is discussed before. I suggested following the Alberta system. Celebrate when each phase or segment is complete. Please note, you do not have to follow the sequence as I did in the flowchart. You can run phases concurrently. Have a successful project. Acknowledgement. I am thankful to Tapun Chaudhuri, Health Economist of Alberta, Dr. Subroto Aditya, and Dr. Tripti Hazra, FRSCGP General Practitioners, for information sharing and idea generation from their real-life experiences. And thank you all for watching this video.